on screen share. Is it on slideshow? Can somebody just show me a thumbs up? Okay, great. Hello, everyone. Good afternoon, good morning for me. I am Tanushree, and I'm going to present on infertility and yoga therapy today. We are going to cover what is infertility, its causes, and how yoga helps in managing infertility. Infertility can feel like a journey of uncertainty for both men and women, but yoga or yoga reminds us that healing is about progress and not perfection. Having said that, before we begin, I'd like to express my gratitude to all the scholars of yoga and Ayurveda, my parents, especially my mother who introduced me to yoga, all my teachers, school, college, yoga institute, where I did my 900-hour certification, and all the teachers at AYG Academy, and my friends and family. So what is infertility? Infertility is basically a disease of male or female reproductive system defined as failure to achieve pregnancy after 12 months of more or more of irregular unprotected sexual intercourse as defined by WHO. 1 in 6, the WHO also gives the stats of 1 in every 6 women of reproductive age worldwide experiences infertility. Infertility can be observed in both men and women. Infertility in men is ability to fertilize mature ova after mating with female partner. It could be due to multiple reasons, which we will see in the coming slides. But as you can see in the picture here, a healthy sperm and an abnormal sperm, if there's an abnormal sperm for whatever reason, that causes inability to fertilize the mature ova. Infertility in men or in women, on the other hand, is because of inability to naturally conceive a child or to carry a full-term pregnancy. So you can see here, either there's no fertilization, there's a problem with the egg, or there's fertilization happens, but the implantation is doesn't go through for multiple reasons, which we will also see, or the miscarriage happen. So it could be any. Now, how yoga helps. Amongst many causes of infertility, yoga supports fertility by reducing stress, balancing hormones, and improving blood flow to reproductive organs, enhancing overall reproductive health. Let's now look at what are the causes of infertility in both women and in men. So these are not all the causes of infertility. These are some common causes and some causes that range across both male and female in different ways. So when we look at hormonal imbalances, women have PCOS, irregular periods, irregular ovulation cycles, or men have low testosterone level. Something that is common in both is thyroid disorders, pituitary gland disorders, and immune infertility. I'll just explain quickly. Thyroid disorders, if it's a hyperactive thyroid in both men and women, it causes lack of, in women, it causes lack of ovulation. In men, it causes lack of sperms. And if it's a hypothyroidism, in women, especially hypothyroidism causes inability of maturation of eggs or prevent maturation of eggs. Pituitary gland, on the other hand, is related to FSH and LH hormones, which we studied about, and I won't go into details. But if it's a pituitary gland disorder, then these two hormones get disrupted. And immune infertility is basically when your immune system starts attacking your sperms or your eggs, and in some miscommunication with the body, and starts creating antibodies instead for reproduction. So that's about it. Then structural issues are blocked fallopian tube in women or blocked reproductive tract, uterine abnormalities like fibroids or polyps or erectile dysfunction, endometriosis, premature ejaculation in men, chromosomal abnormalities or abnormalities in sperm in men. So, quickly, uterine abnormalities are generally uterine abnormalities relate to uterus, and any problem with uterus causes problem in pregnancy. We've understood now over the course a decline in age, increase in age reduces results in decline in quality and quantity of eggs, or in women and both in men. And the lifestyle factors are obesity, smoking, poor nutrition, and stress. Moving on, we'll look at role of yoga in supporting fertility. How does yoga help in fertility? It reduces stress, it brings hormonal balance, improves circulation, mind body connection, strong pelvic floor for women to carry the baby, and helps in managing weight. That increases the chances of pregnancy. Now, what are certain things that can compass yogic management and can help with fertility for both men and women? It can be managed by nutrition. So, eating more sattvic food, that is rich in fiber, iron, antioxidant, mineral, and vitamins. As ma'am had mentioned over the course of the course a couple of times, that food items rich in folic acid should be consumed. If we do not get it by food, we should include supplements. We should avoid in nutrition is tamasic food and alcohol, drugs, or smoking. How we relax and rejuvenate is also important. So we should do conscious relaxation techniques like shavasana, meditation, pranayam, develop hobbies that allow us to manage our stress, be physically active by walking, swimming, or play sports, and regulate our sleep cycle. And to do more of cooling pranayams to keep the body temperature low, as we know that it keeps sperms healthy. Now, regular yoga and asana practice, all the asanas that increase blood flow should be practiced. Bhadrasana, Setu Bandhasana, we look in the next slide. All pranayam should be practiced because either they're relaxing or energizing. Kriyas like Jalneti and Tratak, and practicing Mula Bandha, which improves pelvic strengthening. And we know that managing mental health is important. Infertility can cause major emotional and mental trauma. Acceptance of the situation is key, and we should always surrender to higher power. And it helps us go through the whole journey. Then the asanas to support infertility. Setubandhasan, Baddhakonasan, anything that really helps the blood flow in the reproductive organ areas. Dhanurasan, Viprit Karni, Supta Baddhakonasan, Matsyasan, Malasan, Balasan, Bhujangasan, and I just repeated Supta Baddhakonasan. These are just a few asanas, and Avni and Kajol also mentioned a couple of them here. So they really help in reproductive health. So to conclude, infertility can cause a lot of stress and anxiety, feelings of inadequacy in both men and women, which can affect their self-esteem and well-being. The journey through infertility creates tension in relationship. We have heard multiple stories from ma'am, pressures from in-laws, tension between couple. It's just too much to take. So yoga just helps in bridging the gap. It reduces stress and anxiety by calming the nervous system. Biologically, it reduces your cortisol, promoting relaxation, which is essential for balancing your reproductive hormones. And like I said, specific yoga poses improve circulation to the pelvic area, which support hormonal balance and promote physical and mental resilience. Thank you.